So a second. And we go to, yes, Abdallah is joining us now. And we've listened to the conversation of a doctor to his patient, and the doctor has completed the patient's form and the case history actually. And so the question, so the doctor asked a lot of questions. Why are the past medical history, family history, social history, and drugs and allergy history important? Why does he ask so many questions?
Can I answer?
Your name? Bakhtavar, right?
Mm-hmm. No. Yes. Yeah, by that.
Yes.
Mm-hmm. I'm Yara. Okay.
Yara,
so,
okay. Yara, okay.
Yes. Because it's help him if he have a large or if he have any disease before to give him what medicine he wants, because some medicine do a rejection with other medicine. And if his mother or sister have a disease which maybe he have from her mom, so
Yes.
it's helped him to don't do a wrong with the patient.
They're inherited.
This is so important.
Yes.
Yes.
Okay. So you've spoken about the previous medical history and family history, why they are important. Anything else? So what about the social history? Yes, your name?
Rola.
Rola, please.
So the personal health history gives the doctor clues about what you might have, and also it prevents risks of health errors.
Okay, okay. So, and of course, so the drugs, Yara was right about the drugs. Yes, so Abdallah, what would you like to say?
Yes, doctor. This question maybe help the doctor to diagnose the patient more specific. And asking about the medicine or drug, it's possible to know the side effect of the drug that affect the patient.
Okay, great. So, and Susan? So
about social history, teacher, I can say that it's important about social history, maybe in a place or in a country or in a society that he is living. It's important that the doctors know about his place, about the people, about the nation. Maybe in the past, the people of that place maybe face with some disease. And I think it's important to ask about the social history as well.
Okay, great. And yes, especially nowadays when we have pandemic, and it's very important. So to know who people the patient contacted with, just to follow what happened to those people. Well, okay, now if we go on. So this is the information about signs and symptoms. So the patient usually tell the doctor, and so the doctor just writes about this in a case history, and so we should differentiate between signs and symptoms. So here there is a definition. A sign is an indication of illness that the doctor sees, but sometimes it's not apparent to the patient. And on the contrary, a symptom is what the patient noticed himself or herself. And as you see, sometimes signs can be classified as symptoms and vice versa. But the main thing that sign is for the doctor and a symptom, so what the patient can see himself. Well, and so if we move to the next slide, there is a description of one of the conditions. And there are signs and symptoms that a person has when this person is ill in this condition. And we should decide whether these are signs or symptoms, or some maybe both. Yes, Yara, please.
Okay, so the first one is symptoms.
Blocked nose, you mean, is a symptom.
Yes, yes.
Then, yes.
And the second one is both.
Can be both. Raised temperature.
Yes.
And
the third one.
Why do you think it can be both? Raised temperature.
Because the patient feel in this, and the doctor can see it. So I think it's like the definition.
The doctor can measure the temperature, right?
Yes, yes.
Okay.
And the third one, I think it's also both.
Does it mean that the patient also feels tenderness over his sinuses?
Yes, sure.
Okay, sometimes. Okay.
And the fourth, I think it's symptoms. The doctor can't imagine this. Runny nose, maybe it's symptom also.
Okay, let us just compare with what we have on the next slide. Okay, so you were right. Actually, sometimes when a person has, when his nose is blocked, so maybe the patient doesn't realize the tenderness over his sinuses, but the doctor, when the doctor examines him or her, so the doctor can see this, and this is the sign for a doctor. Okay, great. And so if we have a look at condition B, just a minute. Ibrahim Hassan.
Yes. Raised pulse, it's a symptom.
Mm-hmm.
And recent vomiting and diarrhea, it's a sign. And the third one, it's
dehydration.
Yeah, dehydration is symptom. And abdominal tenderness, it's a symptom also. And crampy abdominal pain, it's a sign.
Well, you say that pain is a sign. So sign, something that the doctor can see. But symptom is what the patient notices himself. I mean, can the doctor see abdominal pain, or he just writes about this in the case history because the patient says about this because the patient feels it. So, so this is symptom, right?
Yeah, it's symptom. Yeah.
Sure. The same about recent vomiting or diarrhea. So the doctor asks his patient questions about vomiting or diarrhea. So when this is like what the patient feels and experienced himself. Maybe about the raised pulse. This is like the patient doesn't realize that his pulse is raised, and only the doctor, when he examines the patient, can feel it, can see this. It can be sign sometimes. Dehydration. Dehydration. Do you know the signs of dehydration? What are they? If a person is dehydrated, so what happens?
Dry skin.
Dry skin. So you as Okay. You as a you are a specialist, you can understand, but sometimes people do not feel that they are dehydrated. So, and this is mostly the sign for a doctor, not the symptom that the patient comes to a doctor and says, I'm dehydrated. So you should drink water, so you should do something. And abdominal tenderness also when so a doctor examines the patient's chest abdomen, the doctor can feel that there is some kind of tenderness, and this is a sign for a doctor. And if we think of diseases, which diseases the signs and symptoms might relate to? Yes, Roa, please.
I think it is asthma and sinuses and maybe gastroenteritis.
Okay, in the first condition, asthma, sinusitis, right?
Yeah.
What other diseases are associated with this condition? I mean, the first condition, condition A. So, headache, worsen, bending, runny nose. Can we speak about just a flu? Is it possible? Or
Yes, it could be a cold.
a cold even? Okay. Yes. And condition B, you say, what is it? Roa? Okay. So any ideas about the diagnosis for condition B? So, Bakhtabar, what do you think?
Doctor, I can get the question.
Sorry?
Doctor, I couldn't get the question actually.
So what is your diagnosis for condition B? What is the disease?
Doctor, for first one, it is for days, rise, falls, listen, vomiting, diarrhea, dilatation, abdominal, and abdominal pain. I think it is inflammation in her stomach because it has vomiting and diarrhea both, and also dehydration. It loses a lot of the body water, and also it has some pains in the abdominal, and also it causes that when he loses his body water, it causes that the pulse it rest.
And what is your diagnosis?
It is some inflammation. How can I say it? Stomach problems.
Some stomach problems. Okay. Aon, do you have anything to add?
Yeah, doctor, it's sensitivity or poisoning.
Okay, poisoning, right? Okay,
Yeah.
so yes.
About the B pictures, teacher, we can say that because of dehydration that he has, we can say that he can drink water every day, and also he must drink water every day. How can I say, 8 glass, at least 8 glasses, and also we can suggest him that he can use from boiling water because of his abdominal pain.
Okay, you are speaking about the treatment, yes? So you are prescribing the patient. So what the patient should do. Okay, so
Yes.
Thank you. And well, so now let us focus on the disease which is called pneumonia. And let us make a list of the signs and symptoms you would expect to see in a patient with pneumonia. So what signs and symptoms that the patient speaks about tells you as a doctor show that this is pneumonia. Let us just think, just I'll give you 1 minute to write the list of the signs and symptoms, and then we'll discuss, we'll compare together, okay? 1 minute for you, start please. Well, so who would like to read the list of signs and symptoms? Okay, yes, Rola, please.
Okay, so the patient can feel, or it could be a sign too, a high fever, high temperature. He can also, a symptom is he coughs a lot of phlegm, and he might feel chills, lose appetite, and feel tired. And a doctor could tell the fast breathing and heartbeat.
Okay. What about any pain? Can the patient feel any pain in his body?
Yeah, he could feel chest pain when he coughs or take a deep breath.
Okay. Okay, so can we add anything to these symptoms? Yes.
About this is, we can say, teacher, the sign that the doctor can see it. It's about the viruses and the bacteria that it can in turn to this pneumonia, and also about the pain that this patient can feel in his chest, and maybe some cough, and also he cannot eat everything, and these are the symptoms. And about the signs as well, we can say the blood test, the chest x-ray, that they are related to the signs that the doctor can see it.
So you just repeated what we've already said. Okay, good, thank you. So it's clear, we understand the difference between signs and symptoms. Now, let us focus on the next slide, and here, this is the information about the non-technical language, about the vocabulary. So, and when you as a doctor, you speak to a patient, you need to use non-technical language, the language that the patient can easily understand. Let us look at the 2 example questions from the case history. So that the doctor asked his patient in the conversation that we listened to. And the question, which verb, which is highlighted in these questions, means precipitate, and which verb means start? So in the first sentence, the first question, number 1, when do the attacks come on? Rola?
Start. When do the attacks
Start, exactly. So this come on is more conversational phrase. And in the second sentence, are you aware of anything that triggers the attack? It's what? Precipitate. Precipitate is more formal, but in the conversation, the doctor can see this, can use this word trigger. Well, and if we move to the next slide, let us just, yes, here we can see the practical exercise. So it deals with the non-technical and specific medical terms, we should replace the words which are highlighted in blue and given in italics with non-technical words from the list, which is given to the right. So in a column. So, and sometimes you should change the form of the words that you use to replace. Now let us look at the first sentence and let us listen to Abdallah. So what do you suggest to use instead of the word which is
We are going to have to do a few tests.
Yes, to have to do a few tests. Yes, so we use the verb to do instead of perform, which is more formal perform. Okay, now let us just do this task individually. Like 2 minutes for you to complete the sentences, to change the sentences, and then we'll check together. Okay, now start, please. Well, so it's time to check. Well, Aon, please. Will you read sentence number 2?
Sure, doctor. She is suffering from a very bad bout of flu.
So instead of suffering, what should we use? Well, so Abdallah, what do you think?
She's has got a very bad
It means she has got a very bad bout of flu. Okay. Abdallah, what do you think of sentence 3?
It might be a good idea to fatty food for a while. Avoid
Fatty food. Good. So then, Ibrahim, please. The next sentence.
He's tilted to many minor lenses. It's prone.
Is prone to many minor diseases. Okay, illnesses. Then Roa, the next is for you.
Yeah, you say the cough comes and goes.
Exactly.
And we will add the s to the verb because the sentence is present simple.
Exactly. Comes, the cough comes and goes. Good, well done.
Yeah.
And
you.
so, Rola, please.
Your cough is persistent. Your cough is there all the time.
Great. Okay. Yara, please.
So it's difficult to. This is this stick to. Yes.
Yes.
Any kind of life change.
Yes, to stick to good. Bakhtavar, the next, please.
You won't have to be hospitalized. You won't have to be booked.
Well, when a person comes to a hospital, so the people, the doctor, he says, yes, you can just come and we'll take care of you. What does the doctor say? What does the doctor do when he agrees to take a patient? To book,
Admit.
to admit. So you won't have to be admitted, right? This is the form. And the next one is for Suzanne.
Your can you pronounce, teacher?
Scheduled.
Schedule. You're scheduled to see the nurse in the allergy clinic next Tuesday. You're stick to.
No,
You're booked to.
You're
booked to see.
Exactly. You're
Yes.
booked to see. Yeah. So this is to book means to write something on a schedule, on a timetable. So to plan something. Okay. So these are the pairs of words, technical and non-technical, formal and more conversational words. And if we have a look at the next slide, so what should we do is we should use the phrases like here on this slide, the beginnings of some questions, and these informal, conversational, non-technical words. We should use them in role-playing a conversation between a patient and a doctor, and the patient who has a flu or a cough. So the doctor should follow the Socrates model we were speaking about, should ask some questions like when is there, do you, did you, and so on. Some example questions. Are you prone to, are you booked to see, do you find it difficult to stick to medication? Does your cough come and go? Have you ever had, and so on. So we need 2 volunteers for a doctor and for a patient. Who would like to be a doctor in this conversation?
Can I?
Your name?
Rola.
Rola, please, is a doctor and a patient. It's very easy. You should just only ask questions. Your name?
Yara.
Okay, Rola is a doctor, Yara is a patient. Yes, ladies, start, please.
When did it start?
Maybe from 2 days.
Is there anything that precipitated it or triggers it?
Actually, I don't think so.
Do you have any pets or allergies?
I have allergy from the cat, but I don't have a pet.
Did you ever experience something like this before?
No. This is my first time.
Are you taking any medication?
No. Maybe some of Ventolin because I have asthma.
Should we complete, doctor? Or is it enough?
So is the diagnosis clear?
Yeah, I think she's having.
yes.
She said she's allergic to cats.
Allergic to cats, and so the main disease is like asthma. Yes.
Yes.
So there is no need to ask any extra questions. And but look, so you've said when did it start? You didn't give a chance to the patient to say about her condition. So first, like what you mean? Cough, flu? So because I don't understand what you are discussing. It. And yes, well, and yes, when you ask the question about something that precipitated, it's better to use triggers. Is there something that triggers your condition? Yes, good. This is just the way we should. A doctor should ask questions about patient's condition. Well, and now let us listen to the second part of the conversation between Dr. Dixon and Mr. Bloomfield. And the doctor asked some questions about the general history. And let us write down the questions, listen and write down the questions that the doctor asked about appetite, bowels, waterworks, and sleeping. So here on this slide in the picture, you can see the illustration, the picture that illustrates the this just word bowels. So you can see in the picture, this is the lower part of, it's located in the lower part of the body. It's part of the digestive system. And so the second picture shows the parts of the body, the organs involved in waterworks. So the kidneys and other parts of the body. Well, now let's listen and write what the doctor asks about these 4 things now.
Listening 3.
Can you hear?
Yes.
Okay. Mm-hmm.
Okay. Do you smoke?
No,
You drink?
just socially. Maybe a couple of beers a week, nothing more than that.
Is your appetite okay?
Yes, I never seem to have any problems on that score.
Bowels okay?
Yes,
Waterworks okay?
yes,
Sleeping okay?
yes,
General health okay otherwise?
yes.
I think we'd better have a look at you. Could you just pop behind the screen and...
Mm-hmm. Well, so what are the questions? So let us listen to Bakhtavar.
Doctor, he asked that it is your appetite is okay, it is bowels is okay, it is waterwork is okay, and it is sleeping. It is your sleeping is okay.
Actually, his questions are shorter. Bowels okay, waterworks okay, sleeping okay, right? Well, he shortens his questions. Why does he do this? Because he asked the form of the question is the questions is the same, and just he goes through the list of just necessary questions just to understand the situation. And but anyway, we understand that he means so he knows how to ask the full question, and he knows the form of the question. Like here in the example, the doctor says, "You been off work at all?" It means, "Have you been off work at all?" Let us expand the questions. Who would like to read all of them and just reconstruct the full form? Yes, Abdallah, please.
Yes. Could I? You eating well?
Sorry, will you repeat, please?
You eating well? Have you been eating well?
Okay.
You're a bit okay. Is your appetite okay?
Is your appetite okay?
Yeah. You sleep okay? We
Sorry?
can say, are you sleeping okay? Or have you been sleeping okay?
Yes, okay.
You passing water a lot? Are you passing a lot water a lot? Your beard's okay? Have your beards been okay?
It's better. Are your periods okay? Like this.
We can't use have.
No, because the main verb here is to be. So your periods are okay. This is the sentence. And the question, are your periods okay? Because there is no verb to have here in this sentence. What about number 6?
We can use have. Have you had any diarrhea?
Diarrhea. Yes.
Lost any weight? Have you lost any weight?
Exactly. And
been living there long? We can use have you been living there long?
Exactly. Well done. Great. So these are the questions, and yes, so the question is, yes, we should have to pause our class and